just walking over. Good morning, everybody. Happy Friday.
Hi. Happy Friday.
We've made it.
Yes, we have.
Took a while to get here, Friday did.
Yes,
Been waiting all week, basically since Monday.
Hey, we are asking about the coronavirus this morning. Now there's an infected person in every single continent except Antarctica. Mexico now announcing they have 2 infected people this morning. How worried are you guys about this? We ran a poll this morning. You guys can still vote on it. And we wanted to see, there it is. Are you concerned about the coronavirus? And wow, 60% saying yes now. Earlier it was a majority of somewhat. So that's interesting to me. Keep voting. You can go to kgw.com/vote or hit the vote tab in our news app or comment live with us. We are watching your comments on Facebook.
Yep.
I'm watching you guys on Twitter and YouTube. Drew, if you prefer to text us, you see the number right there on your screen, 503-226-5111. Text us while you watch.
I prefer, if you do text us, you use a name, because we can't see a name just
we
by
just
a
see your
number.
phone number, so tell us your name.
Yes.
Absolutely. I was listening, and I listened to it twice because I thought it was so succinct. The New York Times, the daily podcast, has a coronavirus episode, and their reporter, who's covered many different epidemics globally, just gave a debrief about exactly what it was. It was like all information in one easily digestible format.
Yeah, it's like
and one
20
thing
minutes,
that I didn't really understand is that the coronavirus, there are 6 strains, 4 of them are responsible for 25% of the common colds. And so when we say it's a new coronavirus, that's
what
why.
we mean, yeah.
Because they say all of us have had a coronavirus, but we just call it a cold.
Cold. Yep.
Exactly. But this is different.
People have a lot of questions that were coming in all morning long. I wasn't monitoring the text line throughout the course of our TV show, but I see that people were commenting about coronavirus by way of text, 503-226-511 if you want to chime in right now by texting us. One of the questions that came up was from one of our texters: does having a current flu shot and a past history of having flu shots provide any benefits to reducing the severity of this coronavirus?
0.
No, it does not.
Another question. I'm a driver for rideshare, Uber, Lyft. I pick up riders at transportation hubs like airports, bus stations, train stations, etc. What precautions should I take to lower my risk as much as possible?
That's interesting. The other thing that the New York Times reporter was talking about is that it spread primarily 2 ways, through coughing and through surfaces. So if somebody's infected and they're here at the table and we don't know it and we come here, we can pick that up.
Then you touch your eyes, nose,
Exactly.
mouth, and then
it goes in.
become infected.
And
yeah.
this coronavirus lodges in your lungs, and that's the thing that is troublesome. It causes
into
pneumonia.
Yeah.
And
Okay.
then that's what's killing a lot of people.
One more texting question. Is it possible, this viewer asks, is it possible to be a carrier but not get sick from the virus?
I think I'm going to say a yes from what I have been reading. Especially, it makes me wonder about the woman who was in, Forest Grove too, and the one in Northern California, whoever that patient is. Asymptomatic, said that, I haven't been to China and I haven't been around anybody who's sick, but maybe it was there in some way, shape, or form and then manifested itself. But there are people who are asymptomatic.
And the Forest Grove woman has said she's felt fine and she's been stuck in the hospital in Tokyo. She was on that cruise ship in Japan.
They also have that person in China who was asymptomatic and infected 5 members of their family.
Right. Yeah, and they didn't know that
they didn't know that they had it.
I'm not worried about it, and I have been since day one when we started talking about this. I was like, listen, I'm the one that's always been comparing it to flu numbers, and then I think in that podcast they're like, it is worse. Like if you were to get it, it's more pneumonia than flu, which is more serious to older patients who were to get it. And I thought was really interesting, like kids are very unlikely to get coronavirus.
Yes.
But I think the most important thing to remember is 80%, even if you get it, 80% of people who get it, it's mild. It's mild, you're fine, you get better.
Yes.
It's the older people, compromised immune systems that you have to worry about.
I mean, you would actually say, if I asked you
fatal.
point blank, are you more concerned about the flu or coronavirus? You would
I'd
say
say
flu,
flu.
because that's the one you're more likely to get, at least at the present
Here
time.
for right now. I also thought it was interesting. They were talking about they likened it to other epidemics in the past, and they were talking about on the Daily Podcast that we could have a spring outbreak. Maybe there are cases here in the States and around the world, and then because the weather gets hotter, the virus is going to go away historically, like it goes dormant
hot weather,
or whatever you
yeah.
want to call it, and then it would come back in the fall with more of a vengeance, because the reporter who covered this was trying to give the host a range of options. What's best case, what's worst case. And best case is that it's just a little something something and nothing really happens. Worst case would be what I just described.
Yeah, getting worse in the winter. What are people saying on Facebook?
Well, I'm laughing. I'm chuckling. Not laughing. I'm chuckling at Jorge's comment. KGW TV, 4 experts. 1, 2, 3, 4. Wow, stop adding to the hype, says Jorge.
I don't want to hype it up, Jorge. I think it's, I'm not worried about it at all.
Yep.
I think we see the video, we think of it as some exotic, it's from China, they're like, this exotic disease is coming to get us, and you see it. You know what I mean, though? Like, that video is so easy to
You're very
throw up
animated,
with
yes.
face masks and stuff, but like, the news love, seeing people with masks walking through the airport, and you're like,
I don't
breaking
feel like
news.
it's some exotic disease.
I think,
but absolutely, I'm
a lot
thinking
of people
about
are like,
travel and that type of thing.
Isn't
I'm like,
it
what do I need to
true
know about it?
that unless something really changes, the bottom line is what we consider to be a typical flu season will go on to kill vast more people.
it's already killed 14,000 in the U.S.
This corona
this
thing
winter,
will. I mean,
the
that's
flu.
so to me, that's
Yeah.
still like, well, the general flu is still the bigger problem. That's
Yes.
if you're just looking at death numbers, so far this isn't even remotely close.
I'm just, I like to mention these just because it's not like we don't see these. And we appreciate all your comments, even when you say stuff like Bill, who says, love all these doctors sitting around the table. I don't think anyone here has tried to suggest that they know more than any doctor out there. What we're talking about this morning is really
we
just,
read
are
a
you
lot
worried?
because
Well,
we
yeah,
have to,
But it's what other experts are talking
Yes.
about. It's what,
And you're
I mean,
quoting
it's-
every source you've read from.
Absolutely. Yeah, 100%.
This is not something that Brenda concocted up in her mind. She's the one article.
I'm just telling you what I listen to.
Right.
Yeah.
So Robin St. Helen, who I know comments often on the Facebook stream. Good morning, Robert. Rob St. Helen says, I am somewhat worried. He admits to having no immune system at all. I don't know if he's being a little bit facetious there, or if he really has like the weakest immune system possible. He says, so if he happens to get it, he would be in really bad shape. Rob, we didn't know this about you. Tell us more if you'd like. Sandy says, LOL, common sense people, wash your hands, cover your face when you sneeze or cough, avoid crowds and people who seem sick. In other words, that's how she is going to avoid this, I suppose, and why she's not worried about it.
Michelle Barber said, I'm already prepped for food shortages,
Wow.
water, and medication. I guess that's talking about the concern that China produces so much. If the production line gets slowed down because their workers can't work, then sometimes people can't get medicine in other parts of the world. And
Well, I asked
whatnot.
Michelle then, were you already prepared with water and food and things of that nature, medication, in the event of any sort of emergency that might strike the area, or have you specifically stocked up in recent weeks because of this coronavirus? I'm just curious, Michelle.
I have an earthquake.
Sure, that's what I'm wondering.
kit
She had that already.
That, I did a bunch of stories on having an earthquake kit, and so I thought maybe I should have one. So I have one with food and big cans of chili and top ramen and a can opener and a radio and all that stuff. And
we got water and then we drank it all. I am the worst with that.
Drink the water that you stocked up.
drank her emergency water. I think that's funny. actually.
I'm doing it wrong. I'm doing it wrong.
Well, I could not eat the chili. Sooner or later, I'd go open up the can
It's
of
in
chili.
the hall closet, so I always kind of forget about it. Men in Pajamas on Twitter, thank you again for watching us. I love your handle. Are the same people so concerned about coronavirus the same people who do not get the flu shot? Interesting question. I don't know.
I get the flu shot, and I am somewhat concerned about coronavirus. They're working on a vaccine for coronavirus.
It's a year out.
Exactly.
Is that
They're
what they
trying
say
to find
now? Is a
something.
year out? Well,
A new you on YouTube. Thank you for watching. She says she has a box of face masks. Her spouse works at a hospital, so she is prepping. Let's see. Other people wondering, how is it really spread? There has to be some other reason than community spread. And I think that New York Times podcast that Brenda was talking about, they don't know, like, if this, could be able to be like go through an air filter in a building and like pop out in another room, and then could that be getting other people sick in a hospital setting, if somebody has coronavirus? They just don't know yet.
this is a big story in some countries. My brother-in-law lives in Seoul, South Korea. So I don't know if this is still the case, because I haven't talked to my wife in a few days now, who talks to her brother Henry. But all of the public schools in Seoul were closed, and her brother runs his own private school academy. So he's been not making any money for, I think, going on about 2 weeks now, just twiddling his thumbs because he's not being able to open his business. So, I mean, certainly there are pockets of our world that, for one aspect or another, are being greatly impacted by it.
And I thought that was an interesting point from the podcast. They were saying it's not just buying supplies that I guess part of the preparation needs to be. It's just getting the mental mindset if, like, your brother-in-law or your you have to hunker down. If something did happen and there is an outbreak, maybe you wouldn't be able to go where you wanted to go, or have your medicine, or food is running low, or whatever it is. It's just part of the bigger picture of just, how would you react?
You
right?
take a lot of those things for granted. The
Totally.
minute your hot water goes out, you realize, geez, I didn't realize how often I use hot water.
Yeah. How much I hate a cold shower.
Yeah, oh my goodness.
I hear ya.
There was, though, yesterday we had the story of the Seattle high school. You just made me think of that when you mentioned your brother-in-law in South Korea and the schools there right now. Yeah. There was a school in Seattle yesterday that closed just because, I want to say, an employee there was traveling internationally. Someone they were traveling with had gotten sick. Neither the person who worked at the school nor the person they were traveling with tested positive for coronavirus, but still, just because of the international travel factor and the fact that this person was with someone who was sick while traveling internationally, they said, you know what, that's enough of a reason for us to shut down school yesterday outside of Seattle, and they disinfected the entire school.
I did go see my doctor for a different matter yesterday. Or Wednesday.
Please divulge.
So part of the check-in process was all these questions that I'd never been asked before. And then I said, are these questions some sort of screen because of the coronavirus? And the young lady said yes.
Okay.
Yeah, have you traveled recently abroad? Have you been having any symptoms?
So they are implementing their protocol of what they ask you when you go see a doctor.
You're right. No, when you go in and say, hey, my finger, I think I sprained my finger, and they say, have you traveled internationally? That does not.
Do you need a Band-Aid?
Wait a minute. What does that have to do with it? Right.
Rich Rivas says, why aren't you mentioning the effect on retirement? This is important as anything. I assume that you're talking about Wall Street and the stock market being down big time.
That is just crazy,
on fears of coronavirus.
you think of like Nike, Apple, Microsoft, Marriott Hotels, all the cruise lines, and all of the stuff that's made in China that is all completely shut down and no one can get to work.
I know it's like on track to be the worst year since 2008.
And of course, the great unknown is we don't know how long it's going to be. I think we all assume it's going to pop back up, but we don't know how long it's going to be down, right?
It was almost at 30,000.
Yeah.
It's crazy. I mean, all the gains that they've made this, for
this
so
year
long,
they're gone. Yeah.
But again,
and if you are needing to get your retirement though now, the timing is crap. Exactly.
I was thinking about that.
If you're in it for the long haul, you're not touching it, so it's all losses and gains on paper. But if you need it, that is a crisis.
No, that's true. Yeah.
I don't know, when I was thinking about that earlier this year. Now I'm thinking about it again this week because, like you said, I'm not there yet, unfortunately. I mean, I got at least 15, if not 20 more years of working to
still have life
start
left.
tapping it. But what if I was nearing the finish line? You start to wonder, like, is it time to pull it? Because, maybe 2 months ago you could have and felt good about things, and now you don't want to because it's gone like that in just the last 7 days. Jeff Strabel says, same thing. He's actually more concerned about the ripple effect. Good morning, Jeff Strabel, by the way. He says, namely my retirement nest egg. I've lost several $1,000s, and I'm less than 2 years away from retirement. Then he says, how about you people? Yes, I'm with you. At this point, I am more concerned about what it's doing to the economy, just personally and in our neck of the woods, than the fear of getting sick.
You know, Paul Kenny, one of our managers here, said have people check cdc.gov because, Grant, if you can see, I mean, that is the top story there, but that is, a perfect place if you've got questions to go to and, right at your fingertips there. So lots of different areas for resources.
And he was,
you don't have to panic.
Speaking of Paul, he sent a link to Alaska Airlines that says they are suspending the change in cancellation fees because of the coronavirus uncertainty. So if people don't want to travel to certain places, you can cancel your flight with no penalty fee.
Yeah, I would hope other businesses would follow their lead there.
Yeah, it's going to be interesting. I mean, the Olympics are what, July?
I know, we're giving away a trip to Tokyo.
We're giving a trip to Tokyo.
Timing couldn't be
Which you can
worse.
take at any time.
Oh, well, good.
I did read up on that. But the Olympics says it's too early to make a decision on anything. They're watching stuff, but boy, wouldn't that be a huge headline?
Because I would assume.
I mean, thousands of people.
They don't really postpone it, would just be canceled. Is that right? I mean, that's a lot of stuff to postpone.
No city could probably step up at the last minute and take that on, I don't think.
And then if that would happen, boy, the athletes that have spent their entire life training and dreaming, and boy, that's
crazy.
That's a hard blow.
Rob McGee on the other side of the fence says not worried at all. It's being blown out of proportion, and it's freaking people out. I wonder, though, and if you believe that, which Rob clearly does, and others are like him, if you believe it's being blown out of proportion, who's blowing it out of proportion and why? Like, what would be the reason?
Well, I think, being a snow forecaster, I can speak on this topic of things getting blown out of proportion.
Oh no.
But I think, and I say this with the utmost respect, just because somebody is talking about a topic does not mean they're hyping it. Just because someone's talking about a topic does not mean they're blowing it out of proportion. If just the mere sound of a topic being voiced to you means that it's being hyped, I just disagree. I don't think that's correct.
I disagree as well. That's well said.
It was well said.
This is a topic that people have interest in, which is why we're talking about it. And I think, which we've stated, that the medical profession, and I think for the most part the politicians in our country as well right now, are really doing a good job of just saying, this is something on the table and we need to keep you informed about what's going on. That's it.
I thought the best part was right at the beginning of that podcast where they interviewed, and I can't remember which reporter
it was. I don't remember.
Well, the health expert, it was a doctor, medical center executive. Anyway, he said his biggest worry in his career is whether he is hyping something too much or not hyping it enough. Right. And he said with this, he's like, I just don't know. He's like, I want people to be in the know and be prepared if it were to come to this, but I also don't want to freak people out. So it is.
But you have to lean on.
Right.
You can't say we're not going to prepare people. I mean, it's always better to overly prepare than not at all, than having people caught with their britches down, so to speak, the old saying.
And if you're interested, it's Donald G. McNeil Jr., the science and health reporter for the New York Times. He was the one who has been covering stuff for years, different things, and he was just a wealth of information. But you're right, if you don't, President Trump is being criticized for not doing enough, not asking for enough. So it's like you can't win.
Yeah, you're darned.
Are you hyping it? Are you not doing enough? It's like everybody has an opinion.
Mm-hmm.
Yeah.
Can I ask you one more question, and then we'll walk away from the week that is?
Yeah. Weekend.
Amber. I haven't heard from this viewer Amber before. Good morning, Amber. Brings up a question. Would any of you, if you had a flight scheduled next week to Thailand that included a layover to Seoul, would you be canceling that flight today, or would you continue on with your plans?
I thought about this because we could very well have plans to go visit my brother-in-law, Henry, in Seoul next week. And if that was the case, knowing what I know right now, we would go.
You would go.
Interesting. Knowing what I know now, I would cancel.
I think I would cancel. Right?
It's the situation viewer Amber is in right now. Hello again, Amber. Amber says she is slightly concerned, but she is not canceling. She says we have tons of sanitizer, and we're bringing disinfecting wipes, and we're bringing masks to the airport.
Thailand is so awesome. Have you ever been there before? It's like the best. Oh man, that's a hard one.
We wish you a great trip, Amber.
You've been dreaming of this
safe
vacation
travels.
and looking forward to something and planning and like so excited. And then, yeah, it's like, do you take the risk and do it, which you probably fine.
Bottom line is everybody has to make
Their own decision.
Yeah.
100%.
Man, that's a tough one.
100%.
All right, Amber, again, we wish you safe travels. Right now, we're going to travel back in time.
Are we?
We're going to wrap up Sunrise Extra with a look back at some of our best moments of the week on Sunrise. That over here, she's like, wait a minute, I thought we went around the sun every day.
Yeah.
I said, no, we spin
every day.
once a day.
We're going around.
And then we go around the sun once a year.
Oh my
so
God.
we're spinning.
And then it clicks.
And then we're orbiting at the same time.
See, now that's interesting.
You should be a science teacher.
Wow, see that? Yeah, that was interesting.
This happened in Northeast Portland this morning where a truck spilled crates full of chocolate milk overnight.
No.
Many kids missing their chocolate milk today, though, at school, huh?
Don't know where that was headed, but
There's an obvious
yikes.
joke here. Does anyone want to take it?
Go ahead.
Well, I was reading the story when I first came in, and suddenly I found myself just crying uncontrollably. I don't even know why it happened, and then I told myself, geez, there is really no reason to cry over spilled milk.
But spilled chocolate milk. That's
Good night.
acceptable.
I'll be here Saturday and Sunday as well. Thank you.
You know, I'm so I don't know the word I'm looking for, but I didn't know what the punchline was going to be until you said
Really?
it.
Everyone in the audience
I
knew the
know.
punchline was before I said the
Underwhelmed.
first
Now you're
word.
gonna say-
I had that feeling of like I should know where this is going.
You are a big old curmudgeon over there on the end.
It doesn't
Nina
work like
Melba.
that.
I agree with Nina.
It
Brenda.
doesn't matter.
It only matters what the teacher
And you
says.
can't see these two arguing about the story.
It doesn't matter.
I happen to agree with her,
It doesn't
not
work
so
like
much this one over here.
dare
Because
you.
listen, the child, the student,
He didn't learn anything.
well, the student who needs that extra credit the most probably deserves it the least.
You don't
Yeah.
And we just talked about that last story so much that our producer told me we're not even going to talk about the next story. So now I'm standing here by myself, and now, yes, I'm joined by my friends. Hello, friends.